We will start with the sessions. First, Corinne Salinas, our project officer in the European Joint Action Jade Health, will start giving the welcome to all of you. She works at JADEA, the European Health and Digital Executive Agency of the European Commission. Corinne, thank you very much for your time to be here, and you can start with your word.
Thank you, Ines. I thought I will give you a short presentation about the context, the overall context. So maybe I can share my presentation now. I'll try to share my screen. Can you see my screen?
Not yet.
Share. Okay. Sorry, just...
Now we can see your, now the presentation.
Yeah, okay. All right. Okay, sorry. Now you see all of it. Okay. Let me move this. Sorry, just... I don't know how to undo this now. Okay, 1 minute. So I just wanted to slideshow. Okay. Now can you see my presentation?
No, I can try to share it if you want.
Because I've revised it slightly, so I've got
okay.
it shortened. So that's why I just wanted to share it. But you know, sorry.
No, take your time. Yeah, take your time.
I think. Because I've got two screens, that's why I'm getting a bit confused now. Here you are.
Yeah.
You see it? Okay.
Yeah, we are seeing your notes as well.
Okay.
Just in case you want to change the configuration.
Otherwise, maybe go ahead, share your version, because now I've got two screens and I'm a bit confused with this. So we can go ahead and we don't waste too much time.
Corinne, okay? Sorry, it's quite easy. You are really close to do it here in display setting, up in the screen, display setting. In the middle, in the middle, display setting. Yeah, left, a bit left in display settings. Okay, push that.
No, this is camera, microphone. I don't see.
No, display setting, display settings. If you push in display settings, you can switch the screens. Pushing there.
It doesn't allow.
No, it doesn't allow.
Maybe.
Yeah. Okay.
Sorry.
All right. All right. Sorry. Maybe it's better if you do it so I can start speaking, and then we don't waste too much time. Okay. So basically, I just wanted to say that in ADEA, I'm part of the EU for Health team, and we are implementing both. So you can move on to the next slide. We are basically implementing projects on mental health. But just before that, I wanted to give you a bit of an overview of mental health figures. According to the Eurobarometer on mental health, yes, as you can see, 46% of citizens have an emotional or psychological problem assessed in the last 12 months. These data are already quite old, dated post-COVID 2023. And we fear that this figure might have increased since then. As you know, suicide is the second leading death of among young people, age 15-19, but it's also very increasingly among the over 75-year-old. And now it's not on this slide, but it's on the slide I've updated. I found data saying that about 20 out of 100,000 people are committing suicide among the elderly people. So it's really worrying. As you know, also Alzheimer's disease is at the global level 7 out of the 10th leading cause of death. Basically, this is where we are focusing our presentation today. Can you move on to the next one, please? So the response of the Commission, and here I'm talking a bit. This is a slide prepared by the European Commission, DG Santé. We are working closely with DG Santé, but as executive agency, we are not in charge of policy drafting. We are in charge of implementing projects. So we are an executive agency in charge of implementing EU for Health projects. The Commission basically issued a communication on the 7th of June 2023 on a comprehensive approach to mental health, following a very wide stakeholders' involvement, wanted to tackle the post-COVID effect of on mental health across the board, and basically tried to ensure that we break the silo and we look at mental health across sectorial lens. This new approach has led to a combined acknowledgement of budget of 1.23 billion in funding opportunities across the Commission. So it really encompasses all the budget from various Director General, and not just Director General Health. And they've been focusing on 12 flagship initiatives that are really looking at addressing progress around that mental health approach across 3 main guiding principles, but I would like to add one as well. So prevention, indeed, this is the top priority, high quality and affordable healthcare and treatment, and equity also in accessing treatment across the board and across different social groups, including vulnerable groups, and elderly being one of the vulnerable groups as well. The reintegration into society after recovery for those who have been in treatment. And I would like to add the 4th one, which is basically addressing the need of the carers and making sure their mental health is also looked after. Next, please. So at ADEA, we are implementing for this MFF and the multi-annual framework financial framework program up to 2027, the EU for Health program. It is a new program that is a post-COVID program that was basically set up during COVID period to address at the time the COVID issue, but also overall all the health-related issues. We ended up with a massive budget of 3.8 billion across that period of implementation phase to address cancer above all, with the which is basically a kind of a overarching issue, and 4 individual pillars addressing crisis preparedness, health promotion, health systems, health workforce as well, and digital transformation of health. So under disease prevention, mental health and neurological disorders are among the 4th group of diseases, alongside cardiovascular disease, chronic respiratory diseases, diabetes, and then mental health, recognized under the group called non-communicable diseases. These 4 groups of diseases account for 80% of the disease burden in the EU and the majority of premature deaths. but only 3% of the national budgets are dedicated to address those challenges. And therefore, there was a need for EU for Health to focus on those 4 diseases, 4 strands of diseases. Now, and I must say that now under the new commission, with the new commissioner, the focus will be more and more given to cardiovascular diseases from now on. Okay. Okay, next slide, please. So the way we operate with the EU for Health program is we work through annual work program, and we deliver 6 types of grants. I thought this is quite relevant for the audience today as well, because not everybody is familiar with what we call joint action. Joint action, which is now this webinar is organized by our joint action, JED Health, is collaborative project involving several EU and associated countries, member states. So here we are, and the main objective is really to address EU health policy priorities, and basically to align with some of the so-called best practice identified under the best practice portal of the DG Santé. Those joint actions are very important because they are basically the policy instrument within the annual work program. They have to align their activities with the priority of the DG. Most of our calls are really open calls for action grant. The calls are competitive open calls where anybody is welcome to apply. It's quite competitive, especially the last one on mental health that we just closed now has been highly competitive, and the budget was only 2 million euro. Next slide, please. The portfolio we have on EU for Health, mental health, looks this way. You know, for the moment we have across 2024, 2025, we had, I mean, now we are in a closing phase for the 4 grants that were in support of MHPSS, in support of Ukrainian displaced people that are based in Europe. For cancer, we have 6 million euro and 3 action grants that are working on providing specific tools to address mental health for cancer survivors. And those 3 grants are at the moment ongoing grants. Then we have 2 major action grants addressing youth and prevention with youth. And then all the others are a mix of projects addressing different groups, and for a total budget of 11 million. What I wanted to say that we had previously legacy projects, with some of you might have heard of. We had a very important program, GA Implemental, that was coordinated by Greece, implementing 2 best practices, one on suicide prevention and the other one on community-based approach for mental health. So this was this program now has been closed, but still it's a lot of our stakeholders in the JED Health joint action are also coming with that experience. So all over the board, the expected policy outcomes really are, you know, to be in line with the communication of the Commission, mental health integrated across all policies, improved access to treatment and care. The equity dimension is very important. The prevention, early intervention is also very important, and the destigmatization and addressing discrimination for mental health patients is also one of the priorities. On top of this, we have also another unit that is involved in procurement. And at the moment, there's 3 procurement contracts for up to 9.7 million euro. One of them is a very important one, and it's really looking at training tools to support mental health workforce. Okay, maybe next one, please. So here I just wanted to say, yeah, the need for synergy. So basically we have on one side the action grant and the other side the joint actions. And we believe that it's important that, you know, across the specific activities or specific themes on Ukraine, on youth, on what I was explaining earlier, on cancer, it's important that we have a kind of a cluster approach. And here, this is the first time we have a program on addressing neurological disorders and dementia and focusing on elderly population. And we think it's really important that the action grant we have, Care for Elders, and the joint action is really working hand in hand to develop synergies. Because it's basically essential to avoid overlaps, ensure best use of resources, and also improve the sustainability of our projects across the board. Next one, please. Okay. So this is an example of synergy with our major JED mentor program addressing digital solutions to improve mental health across Europe, and also addressing stigmatization. Combined with this joint action mentor, we have 8 action grants, and we have also another joint action who is also looking at implementing mental health in all policies. So it's important that, you know, all these projects are trying to work together, providing also some joint results, joint communication events, and this is what we are also looking for and aiming for the new JED program. Next slide, please. So basically, for JED, and this is my last slide, I won't really dwell too much into it. We are really, because you're going to get the full picture with Ines, Elizabeth, and colleagues. It's important that here the focus is really on improving dementia care. And again, we're looking at not reinventing the wheel, using existing best practices that have been already tested across Europe, and addressing service pathways, person-centered care, equity and access to health, and developing new user-friendly IT tools, both for carers and patients. This is what also our project Care for Elders Action Grant is doing, and I'm glad that they're also on the program today. So I'll just finish here for now. Just informing you that we are now also busy with a very important new joint action. We are in the contracting phase with this joint action. It's the joint action on sorry, I didn't realize you didn't see me. It's the joint action on named PRISM, and it's addressing mental health for vulnerable groups. One of the vulnerable groups that has been identified by the 17 member states that will be taking part in this joint action is the elderly group, and addressing the problematic side of being lonely, growing old lonely. So that's going to be the main focus also from the elderly group side. The other two vulnerable groups are migrants and youth. So that's going to be the new joint action. Hopefully will be started in September, and we will inform you in due time about this one. Thanks a lot.
Thank you very much, Corinne. Thank you very much for your presentation. It is very important for all of us to understand the background and also the needs for all these projects related to mental health and neurological diseases. And also for JADE Health, the search for synergies it will be a key point, as we are demonstrating here in the workshop today that we are trying to get all connected. Thank you very much, Corinne.
Thank you.
And now Elizabeth García Alonso from Fundesalud and the coordinator of JADE Health will tell us about the objectives of the project. Elizabeth, you can start when you want.
Yeah, good morning, everyone. I will share my screen. Yeah. I don't know if you can see
Not
the
yet.
whole screen. Okay. Wait. Now?
No,
No.
not yet. I can share it on your behalf if you want, Elizabeth.
Yeah.
Now it's moving. Yeah.
Okay. Good morning, everyone. My name is Elizabeth Garcia, and I am part of the coordination team of the JADE Health project at Fundesalud in Extremadura, Spain. In this short presentation, I will give a general overview of the project, highlight its main objectives, and focus on one of its key components, raising awareness and the essential role of communication and dissemination strategy. Okay, here is the script of my presentation, starting with general points and progressing towards topics more specifically related to communication and dissemination. JADE Health is a joint action co-funded by the EU for Health program, launched in January 2025, and it ends in December 2027. The joint action brings together 47 organizations from 17 European countries, and it's coordinated by Fundesalud in Spain. The project aims to improve and foster health in the EU member state by reducing the burden of dementia and other neurological disorders and related diseases, both at societal and personal levels, through improving prevention and early detection of the illness and improving education and understanding of the disease for relatives, care professionals, and other stakeholders. The project initiative covers the entire pathology from an holistic point of view: awareness, prevention, early detection, treatment, and care methods. Concerning the specific objective, the main specific objective is integrate validated best practices and/or cost-effective intervention across countries and regions through transnational pilot initiative, and the specific objective more related with communication. We have to improve promotion and prevention intervention targeted to fight stigma, to improve the efficiency of promotion and prevention campaigns related to dementia, and to ensure wider and efficient dissemination of JADE Health activities outcomes to improve health literacy and data accessibility on dementia. And now that I have introduced the overall objective of the project, I would like to highlight why communication plays such a central role within. As you can see in the slide, the project includes a dedicated communication and dissemination package common for all the partners and work packages, as well as separated work that you can be technical work package 10. Focused specifically on awareness raising around dementia-related stigma. This structure reflects the consortium recognition that communication is not simply a supporting activity, but also a strategic component essential for maximizing the project impact. Clear, inclusive, and well-targeted communication is key, not only to share findings, but also to foster understanding, reduce stigma, ultimately contribute to positive social change. Finally, now that we have seen how communication is structurally integrated into the project, the leader of the communication and dissemination in Jade Health will now present the activities that we have been carried out so far to develop the communication strategy. Communication is not just about sharing research results. In the dementia-related project, it becomes a powerful tool for changing perception, challenging stereotypes, creating a more informed, empathetic society. Stigma remains one of the most persistent barriers for people living with dementia and their families. It affects how they are treated, how they access care, and even how early they seek for a diagnosis. Poor public understanding often leads to fear, isolation, and discrimination, and that's why raising awareness through strategic communication is not an optional at all, so it's essential. That is why we are eager to hear all the knowledge and good practices that the different speakers will share shortly, so that we can learn from each other and apply this knowledge to the various projects that we carry out. That's all from my side, and thank you very much.
Thank you very much, Elizabeth. Very clear presentation for all of us to know better the project and the main objectives that we want to achieve. I don't know if anyone has any question for Elizabeth or also for Corinne, that she commented before. In the meanwhile, as we are a bit late on time, I'm going to start sharing my presentation. But if anyone wants to ask something, you can open your mic and we... Okay, if there are no questions, then I'm going to share full mute screen. I think that you can see it now. So, hello again to everybody. For those who have arrived late, my name is Ines Rey, and I'm the Communication and Dissemination Manager of the European Joint Action Jade Health. My presentation today will focus on the activities planned in Jade Health to develop a comprehensive communication outreach strategy for the 47 partners from 17 countries participating in the project to gain knowledge on how to communicate in the field of dementia and other neurological diseases, and thus contributing to raise awareness and fighting stigma in this field. Here you can see the main points of my presentation. I will talk first about the activities we carried out to get knowledge from experts in the field of neurological diseases. Then I will talk about the relevance of having a clear idea of some concepts and terms to be used when communicating in the field of dementia and other neurological diseases. And I will also mention some good practices that we have designed to be carried out in Jade Health, aimed at raising awareness and of dementia and fighting stigma. One of the very first activity we already carried out in Jade Health, aimed at getting good knowledge from experts in the field of dementia, was to elaborate a survey that was sent to all the partners participating in Jade Health. We wanted to learn from the healthcare professionals and learn from those who care for people living with dementia and other neurological diseases, and also from those who design the national and regional policies that can affect people living with dementia, the policymakers who work in the public health administrations. It is important to highlight that most of the partners of Jade Health are healthcare organizations and national and regional ministries of health. We have gained valuable insights from them through this survey, and we also discovered how happy they are to share their knowledge. This is such a sensitive field, and it is so important to exchange knowledge, to find ways to improve as much as possible the condition of people living with dementia. I want to take this opportunity to thank all the Jade Health partners for how responsive they are being. It is fantastic how much they are collaborating. In addition, we organized this workshop to exchange information with European projects and initiatives that are working so well in this field. We wanted to learn from their good practices to design and implement a good communication strategy in this field, and also to share our knowledge with all of you, to start generating discussions among all of us and find synergies to collaborate with each other. We are also conducting a comprehensive review of existing guidelines and best practices at the European level and also at national and regional level. I have included here only some of them. And another activity that we have started and that will continue during the entire duration of Jade Health is the involvement of as many stakeholders in the field of dementia and other neurological diseases as possible. I have left here a QR code that while I'm speaking, you can scan and know how to become a stakeholder of Jade Health. Who can be a stakeholder of Jade Health? Every European, national, regional, and local entity working in the field of dementia and other neurological diseases. We are not only interested in entities with European or national impact, we are also interested in those entities that work at the local level, because these entities are the ones that are collaborating on a daily basis with people living with dementia and have a great power to raise awareness on the ground. They organize many activities at the local level that allow them to reach other people who are not easily reached by national or European entities. Now I will move to the second point of my presentation, which is addressed to clarify some concepts and give an idea of some terms that we should use or avoid when communicating in the field of dementia. I want to thank all the Jade Health partners who have contributed to identify these terms and mistakes that many of us who are not experts in neurology may make. What are neurological diseases and in which state dementia is? A neurological disease starts with a damage in the brain and it may evolve to a cognitive impairment. If the damage is very severe, then it can lead to dementia, causing incapacity to perform activities of daily living. Not all people with cognitive impairment may have dementia, but all people with dementia have a cognitive impairment. It is important to understand, for all of us to know the stage, how severe is the stage when a person has dementia. Examples of neurological diseases are Alzheimer, vascular dementia, Lewy body, and this is different from mental health diseases that are more related to psychological, emotional well-being, like for instance, anxiety, depression. And also we have noticed that there are some confusion with some concepts. For example, when talking about Alzheimer's disease and dementia, Alzheimer's disease is a specific brain disease and a type of dementia, but there are people with Alzheimer who may not have dementia, although Alzheimer is the main cause of dementia. So there are some minor important things to take into account when talking about Alzheimer, dementia, neurological diseases, mental health. Regarding terms to use or to avoid, our clinicians recommended us to avoid describing a person as a patient or demented or dementia patients. Instead, refers to person with dementia. Use person-centered language, person living with dementia. Our clinicians also recommended to use cognitive impairment or cognitive disorders when talking about people with mild problems, because if the damage is not severe, they have not developed yet dementia. And use neurocognitive disorders when talking about people with severe problems, as in dementia. Also to avoid terms like insane, crazy, senile, victim of dementia, disabled, incompetent, burden to society, family. Well, many of these terms are very logical that we, when we are communicating in the field of dementia, we are not going to use it, but yeah, it is important to bring them up in any way. Also avoid negative words like suffers from, victim, instead use a person with dementia. Avoid bedbound, chairbound, instead use impaired mobility. Avoid aggressive behavior, instead use challenging behavior. Avoid the elderly when speaking about older persons, instead use older adults. Avoid negative expressions related to older people such as inactive, old. Well, now I'm going to give some information on some pilot actions we will implement in Jade Health to raise awareness about these diseases and fight stigma. One complete work package, as Elizabeth commented in the project, is addressed to raise awareness. One of the pilots will be carried out in active aging centers where older adults are living. The pilot actions will consist of information sessions addressed to early detection of dementia. They will also be addressed to give information on methods that can lead to activate older adults to prevent development of dementia, and trainings on how to treat and care for persons living with dementia. Other pilot actions will be carried out in mental health hubs, which help young people with a mental health issue to carry out healthy activities related to social connections, physical activity, healthy eating, sleep well. And the pilot actions in Jade Health will consist of information sessions addressed to early detection and to give information about neurological diseases and symptoms, available support resources and services, and give them educational materials. Other pilot actions will be addressed to give information for early detection and trainings to caregivers in elderly care homes and to general practitioners and nurses in primary care centers, which are critical points for early detection of dementia and other neurological diseases. Also, another pilot action will be addressed to clinicians, nurses, and medicine and nursing students in hospitals. They will consist of trainings for them to know better how to treat persons living with dementia, because they may know much about the treatment of the disease, but maybe not so much about how to deal with these patients. Other pilot actions will be addressed to raise awareness at schools and local libraries. Information and educational materials about dementia will be given to children at schools and citizens in libraries to show them how to identify and help people, help persons living with dementia. And another very important pilot action will focus on the public health administration. Information sessions will be given to policymakers at European, national, and local level for raising awareness and move them to make neurological diseases, dementia, and other type of diseases a priority when designing health policies. They will receive information about the incidence of dementia and neurological diseases in the global population, about healthcare costs and potential savings for the health system, which we believe can make them invest more in measures to improve life of people living with dementia. That's all from the pilot actions, but I would like to highlight that many educational materials will be generated, as well as the description of the pilot actions will be made public in order that other regions and countries than those involved in Jade Health are able to replicate the pilot actions if they are interested. In addition, out of the pilot actions, other general activities will be carried out to contribute to communication, raise awareness, and fight stigma. A social media campaign will be carried out from January 26 to November 27, focused on 7 strategic themes: raise awareness of dementia and neurological diseases, reduction of stigma associated with neurological diseases, prevention of social isolation, promotion of friendly and accessible environments, and encouragement of early access to diagnosis and care. One post per week will be launched, and different materials will be produced, such as videos with people with dementia telling about their own experiences, infographics, educational videos. Another activity that we will carry out I don't know, I cannot move the, well, I will tell it without the slide. Another activity we will carry out in Jade Health will consist of a photo contest aimed to portray everyday scenes that help normalize the disease, involving society in the process. I would like to highlight that the language of Jade Health is in English, but it is expected to reach many countries with different languages. So we will work on the translation of materials on those different languages, because it will be the only way to effectively reach citizens from different countries, many of whom probably do not know English. So regarding the photo contest, we will launch a press release in the different languages to promote it around different countries. The best photos will be exhibited in different local events we will organize in Jade Health countries, and a digital book will be produced with these photos and promoted in different World Days and periods, such as, for instance, the Dementia Action Week, the World Alzheimer's Day. Also, local events in partners countries will be organized. Events in libraries, cultural talks, health professionals and project participants will present information about dementia and existing resources, and the audience will have the opportunity to ask questions, share personal experiences, and directly obtain useful information and advice. People living with dementia and their families will be invited in order to give them voice and for them to have an opportunity to inform the general public about the most important aspects to take into consideration with respect to these highly stigmatized diseases. Lastly, well, we cannot see because my presentation I cannot move it. Now. Lastly, I have included some relevant sentences that may help us understand best the importance of raising awareness about these diseases. Up to 45% of all dementia could be delayed, slowed, or even prevented. Many people still mistakenly believe that dementia is a normal part of aging, denying people access to timely diagnosed treatment, care, and support. By raising awareness and combating stigma, we can bring much more effective and combined therapeutic and care solutions for those who need them most. We must recognize dementia as a public health priority and invest accordingly. I think that there are very important reflections in the field of these diseases. Well, thank you to all of you on behalf of the consortium of Jade Health. And while I ask if anyone would like to ask any question, please turn up your microphone. And I will leave here a QR code to our website and social networks. It will be great that you enter our social network and follow us, so you will receive all the information related to the pilots and the materials we will produce in Jade Health. I'm going to stop sharing now. I don't know if anyone wants to ask any question. Otherwise, yes, I will give the floor to Tom Tobes. Tom is a very recognized activist in the field of dementia. Tom, you can start when you want. Thank you.
Many thanks. I will share my screen. Is everyone able to see the video now?
Yeah, we can see it.
Perfect. Welcome, everyone. It's great to see so many people together around this important topic. In the next 12 minutes, I will bring you in touch with my message, which is Humor Forever. Humor Forever is a film which I made together with documentary filmmaker Jonathan de Jong. It is now being screened in 22 countries, and we have won the Golden Calf with it, which is the most prestigious film prize in the Netherlands for the most cinema goers. So we reached the most people ever in cinema with a film about dementia. There we go.
I think that we cannot hear the sound.
Oh, you can't hear? Can you screen it, Ines?
Yeah, I think so.
Is that possible? Yeah, it's easier.
Yeah. Yeah, because the video, I find it very important.
Yes.
Sorry.
Mijn naam is Steun. Ik ben 24, kerngezond en woon op de gesloten afdeling van een verpleeghuis. Waarom? Ik ben 24, maar niet heel mijn leven. Daarom ga ik nu op zoek naar antwoorden voor later. In een reis van 3 jaar door 11 landen en 4 continenten kijk ik hoe wij in de wereld omgaan met dementie en de mensen die hiermee moeten leven. En hoe kunnen wij de samenleving in de toekomst inrichten voor de mensen die onze aandacht zo hard nodig hebben, maar die wij zo vaak vergeten? Iedereen, ondanks leeftijd of diagnose, heeft toch hetzelfde recht op een goed leven.
Ja, ben je toch helemaal niet meer van enig nut.
Heeft u dat gevoel?
Ja. En het is toch ook zo? Wat voor nut heeft het nou nog als ik leef?
Could you click next, Ines? Yes.
Yeah.
Could you click once more? Yes. Thank you.
Okay.
Oh, no, one back. It's a video as well.
Okay.
Yes. Yeah.
I'm going to turn on the video.
Well, I saw the question in the chat. I will send my email later in the chat, and then you can email me. I will send you the full film. At the age of 21, I decided to start living on the close ward of a nursing home because I deeply feel worried about the future of people living with dementia and the way we treat people in society. Because now we mainly see dementia as a care problem, but in the end, it's a societal issue. It asks for a different way of looking at dementia. So not only focusing on loss, because we don't help anyone with it, but having a more nuanced approach. So that's why I so strongly believe that seeing differently leads to doing differently. And because of that, I wanted to live together with people whom we so often forget. For instance, my housemate, Ellie. You see her here in the video. I lived on the close wards in total for 3.5 years. And I got great friendships with people with dementia on the one hand, but I also experienced that we created a system in which we mainly focus on control and safety instead of humanity and dignity. I only had one big privilege during those 3.5 years in a nursing home, as you see here in the video, and that is that I had the code of the door to leave. I had the code 2017, so I was allowed to go out. I was allowed to go out of and into society, to go to the university, and my housemates weren't. So when I came back in the nursing home, and I heard from the care, Teun, could you please be less close with Ellie because she feels so sad when you are not there. And of course, I totally understand this reaction on the one hand, but on the other hand, isn't it beautiful that someone at the age of 92 who lives with dementia is able to feel sad, and that someone is able to feel lonely is if her friend is not there. So in short, that you are allowed to be a human being. If I ask you who feels happy all the time, then no one will raise the hand, because being happy all the time, it's not a realistic expectation of life. But if we look a little bit more critical to the expectation of society towards healthcare, we often believe that we can make people happy and that we can keep people safe. So if we go to the next dia, this is the place I lived in for 2 years in Utrecht. Then I moved to a different home for 1.5 years. Here you see the close wards, and this is not something which was born during the Big Bang. This is something which we created as a society ourselves. And this really tells us that our healthcare systems are based on collective safety, striving for collective safety, but also based on stigmatized views on people like you and me. And in fact, this message is not about dementia. It's more about the way we create systems for people without listening to them, what people need. On the left, you see my housemate, Yul, and on the right, you see my housemate, Will. And when I look at this picture, it really reminds me of the way we create systems, but more importantly, the way we believe we can improve care. And that's a big problem, because our main focus, I have a background in nursing and I have a background in care ethics and policy. And the main focus is often to improve quality of care. But if we start listening to people who are living with dementia, it is not about quality of care. No one is happy if you have good care only. It is about quality of life. And good care can be an important tool to facilitate people's quality of life. But if care remains the main focus, then people feel treated as a patient. In short, especially in the Western world, in the global North, where there is a lot of wealth, a lot of prosperity, a lot of welfare, we often believe that more is the answer to everything. So we want more money, we want more products, we want more healthcare workers, in our belief that more automatically leads to better. But that is not always true. It is about what do we do with the resources we have. So also in the Netherlands, which is a really privileged country when it comes to the amount of money we have, we spend a shitload of money on products. We have 18 billion euros, which we spend on nursing homes. Every nursing home in the Netherlands receives over 100,000 euros per person a year. So if we still say that we need more in order to change, then we give the keys to change to someone else. We have to change within the system. If you look on the left of this picture, you see this green wall, which is called an imagination panel. It costs 3,000 euros with a furry of a rabbit, a furry of a cat. And the idea is that people with dementia can grab those furries and then they feel that they have a meaningful day. But what I learned from my housemates is that my housemates don't want to be entertained. People want to have a meaningful day, which has a really different focus. So what we constantly do, we add products to a systems which is currently still excluding people. And that is what we have to change. Could you click next, please, Ines? So here on the left, you see my housemates, Ad, Ellie and Tineke. They unfortunately all passed away. Like on average, people live for 8 months in a nursing home in the Netherlands. So it should be about quality of life. And always when I look at this picture, it tells me a lot about the possibilities within our healthcare system, which are not always supporting people's quality of life. In fact, it tells me about the medicalization over the normalization, which is so badly needed. And as someone who worked in a nursing home myself, I studied there, I worked there, and I lived there. I strongly believe that we have so many possibilities that we lost the basic. To give you a few examples, 3 examples, which we really should talk about. If my housemates had the risk to choke, then we would ask the speech therapist for a risk analysis, and then the speech therapist might give a thickener in the drinks of my housemates. If my housemates had the risk to fall, then they might go to the physiotherapist. There will be a risk analysis, and when there's a higher risk, they might give a walker or something else. If my housemates had the risk to not eat enough, for instance, which we all might have because we might feel stressed, we might not feel comfortable, then we write down in the electronic dossier someone hasn't eaten, and we would ask the dietitian for a risk analysis. And when someone didn't eat enough, we would call it someone has a lower intake. It's all medicalized language, which family can read. So we are changing relations as soon as someone enters the healthcare system. And the dietitian might give protein drink, Nutricia, to someone. In fact, I don't say that those functionalities of people like a nurse, a speech therapist, a dietitian, that they can't be meaningful. I don't say that those products can't be meaningful, but I have to say the poverty of our welfare is that we add those products into people's life without asking people themselves, what do you need and how does it support your quality of life? So to really listen to people with dementia, we have to change that approach because we often see the voice of someone living with dementia the same as the voice of the legal representatives, but those voices can be different. Could we go next, please? So what we did for Human Forever is that we looked to different countries, what can we learn from them? And every country said, why are you from the Netherlands coming to our country? Because you are the example. And together with Scandinavian countries, the Netherlands is often seen as a good example when it is about healthcare, but it is often about what is the perspective on quality? Is it safety? Is it the amount of money we have? And Belgium, which is a country in the, below the Netherlands in the south, they are really jealous when it comes to our possibilities, because in Belgium, they spend 1/3 of the money which we have in the Netherlands. But Belgium is copying the Netherlands instantly, blindly. So what was a trend 5 years ago in the Netherlands in nursing homes, for instance, all those stickers on the doors, became a trend in Belgium later and is now a trend in hospitals in the Netherlands. I also work in a clinical setting. And this is really interesting because let me explain one example about this before we go to the time. But we often believe in those products. If you have, for instance, Lewy body dementia, which might be a reality, you face hallucinations. So the way you experience life is different than the way others experience it. You're sitting in a black chair and people are walking outside of the bookshelf. I would ask myself the question, in what way does this support my own imagination, and does it really support people? Can we click next? The interesting thing is about this example is that they have a classical nursing home, but they change the culture within that nursing home. So it is possible to change within the system by organizing differently. This carer went laying down next to someone when someone needed closeness. It's a beautiful example. It's the power of good care lies in the people who give it. Could we click next? And to end with an example, because we are now together with many people from different countries, I really want to show you this example of Moldova, which is the poorest country, if you Google it, of Europe, but it also has a lot of power in it. And I don't say that we have to copy this, because that's not the answer. But what is interesting is that we can also learn from their culture. This looks like a prison if you see it. I've been there 3 times. I did here research as well. So my idea was, this looks horrible. Life can't be meaningful. But what we shouldn't do is judging. We can learn from this. We often believe if a building looks beautiful, then life is meaningful as well. Think back of Leah, the woman with who we started. She said, my life is not of any use at all, but she was living in a beautiful building when it comes to the concept of care. Could we click next? What I saw in this home is that people were helping each other. So people were bringing each other to the toilet, people were giving each other food. And that really reminds me of the way we look at healthcare in the Netherlands, because we see giving someone food, or we see bringing people to the toilet as professional tasks based on risks and fear. They saw it as the basic thing which you do as a human being, as a fellow human being. It's about living together. And the last dia, please. You will see here that people were living with all different needs together. And that's also why I so strongly believe that we really should stop building nursing homes, which we do now, because a nursing home is based on someone's diagnosis, based on someone's indication as an entrance ticket to a place based on exclusion. We should stop thinking in diagnosis and indication only, but support people's inclusion and community. And in that way, I so strongly believe that this is a really beautiful example, because people were not taken out of society based on a unity of someone's care indication, but people with all different needs were still able to live together. So living together is the answer to survive. And that's also why dementia is a societal issue. Thank you so much.
Thank you very much, Doen. I love all your presentations because they are all so close to reality and to the real needs of the people living with dementia that are very important. I'm going to check the chat just if anyone has.
I want to stress that one more thing, if that's possible, because I saw the beautiful variety of people here.
Yeah.
And I also saw some people from the National Dementia Strategy. I'm part of the National Dementia Strategy in the Netherlands now for 4 years. So we are re-evaluating it. And what's an interesting development is that in the past, we were sometimes writing down very unnuanced ideas about dementia. So the first sentence of the former strategy was dementia out of the world. And although I understand it's based on ambition and imagination, I think we really should be more nuanced in having those sentences, because what I learned from my housemates, if you live with dementia for 8 to 10 years, then it might become part of your identity. It's not always something which is separate from your being. So if we listen to people with dementia, it's not always the dementia itself which makes that people fear pain, even though dementia can be painful, but more oftenly it's the way society treats us. So if we recognize that and we destigmatize, then we will make sure that the hopeful future is closer for all of us, and not only for people living with dementia.
Thank you very much. Thanks for the presentation, says Christian. Thank you very much, because it's really inspiring what you are saying to all of us. And we in JIT Health also think that the involvement of the citizens in the development of the public health policies, mainly in dementia, in this sensitive field, is critical in order to know about their needs, their barriers, their suggestions for improvement, and everything. I think that is a key for the success of the public health policy, that we consult.
Yes. Yeah,
the
absolutely.
citizens.
And like in every example, when it is about dementia and policy, you always hear the names like unforgettable memories, a restaurant for mistaken orders, the mental end. Like it's always we put the problem in front in the name. So if we really speak about inclusion, we have to stop using those stigmatizing ideas in our language, because then we create a self-fulfilling prophecy. On the one hand, we stigmatize. On the other hand, we want to normalize. On the one hand, we stigmatize. On the other hand, we normalize. So we have to step one step further. Yeah,
you are fully right, Toyon. Thank you very much. I'm going to check again the chat just in case. Thanks for the presentation. From your experience, how important is it to ensure that the diagnosis of dementia is communicated clearly and compassionately to both the person diagnosed and their family members? And what impact can this have on their understanding, acceptance, and planning for the future? Thank you, Christian.
Yeah, thank you, Kristen. If there are more questions due to the time, I will answer them in the chat. But of course, it's really important to communicate the diagnosis clearly. But also this asks for a nuanced approach, because it's not like everyone has to get a diagnosis to enter a healthcare system. In the Netherlands, we really created a system in which only your diagnosis is your entrance ticket. So for instance, my grandmom was living as well with dementia. She had to go to a center to start her day there, but it was only with people with dementia. And that is what many people fear. So a diagnosis can be really helpful, but not for everyone. So it's really important to communicate it clearly, but we also have to realize that around the diagnosis of dementia, there's a lot of stigmatization we also should break through.
Mm-hmm. Thank you very much.
I work also in a clinical setting now, so I often see that people get diagnosis, and I'm always trying to really be a little bit more humble with spreading the word of dementia, because people get fear of it.
Mm-hmm. Thank you, Toyin. Christian says that he agrees, and thank you for your answer. So we know that you are very busy and you didn't have much time. So thank you very much for your presentation, Toyin, and see you in other places. Thank you very much. Bye. Now I will pass the word to Frederick Jervik. She's a consultant, mental health flagship at the World Health Organization. Frederick will give some information about the health dissemination and communication strategy of the World Health Organization. Frederick, you can start when you want. Thank you.
Thank you. So a tough act to follow after Toon. So apologies, it will seem a little bit dry in my presentation, but I will do my best. So yes, I'm within the. I sit as a consultant both in the aging team and in the mental health team. So, sorry. So this, just to sort of give you the overall framework that we're working with at the moment, although it's coming to an end this year, is the European Framework on Action for Mental Health, which has a strong element looking at neurological diseases, dementia, supporting countries to develop dementia plans. And we there was also a mechanism that was developed to help with the implementation of the framework, which some of you might be familiar with, the Pan-European Mental Health Coalition, which had different work packages, including one, the one I'm involved in, on older adult mental health. So this, oh, this is a video. I'm not sure. Let me see if it, are you hearing it?
Dementia. It affects us all sooner or later, whether we care for a loved one or face it ourselves. It mostly strikes late in life, but is not a normal part of aging. People suffering from dementia experience difficulty with everyday tasks, confusion in familiar environments, as well as memory loss. As the disease progresses, they need help with nearly every aspect of daily life. Often family members are the caregivers. For many, it can be all-consuming, placing a strain on work, finances, and other family relationships, in addition to taking a heavy emotional toll. The World Health Organization recognizes that dementia is a global public health challenge. Worldwide, more than 47 million people live with the condition, with nearly 60% living in low and middle-income countries. This figure is expected to almost triple by 2050. Currently, there is no cure, yet much can be done. By learning more about the condition, we can help reduce the stigma, which is often an obstacle to diagnosis and care. By consulting a doctor for other physical illnesses and psychological distress, people with dementia can live a better quality life. To help prevent dementia, we can keep active both physically and mentally, as well as maintain a healthy lifestyle. Country leaders can make a big difference too. By adapting health and social systems at a national level, they can improve surveillance in order to monitor how many people are affected. Invest in research to help find a cure and improve care. Put safeguards in place to provide protection from physical and mental abuse, and support caregivers so that they can continue to lead a quality life of their own. By working together, we can offer crucial support and resources to those living with dementia, their families and caregivers, and give hope to future generations.
Thank you. That was developed by colleagues at HQ. And one of the things that I wanted to present briefly this morning is with my colleagues, we're developing a regional strategy called Aging is Living, Promoting a Lifetime of Health and Wellbeing in the WHO region, European region. And it's split into 4 main action areas, all of which have links to either people living with dementia or their carers. So, for example, number 2, creating environments where everyone can thrive at any age, sort of ensuring that environments do not create barriers for people accessing the community and support and services and green spaces, etc. Obviously, the number 4, challenging ageism. So that could be raising awareness in schools, but it could also be developing training programs for health professionals to be aware of their own perhaps stigmatizing behavior towards their patients. Sorry, I'm not going around logically. So number 1, revolution, so prevention. So we know, for example, from the Lancet Commission that a lot of risk factors in middle adult years can have a huge benefit in older ages. So looking at some of the ways to instill prevention, health promotion strategies across the life course. And yes, last but not least, transforming our care systems. So better integrated care, better prevention access in primary care, etc. And we've taken a twin track approach. So at the same time, we're looking at older adults today. How can we support them today? What are their needs today? And then thinking about the future older people, so us and the youth, looking at how can we build the foundations today so that they can age better, in better health. And we're running a series of consultations across different sectors, different actors, and the 27th of May, so very soon, we're having a virtual stakeholder engagement with civil societies, non-state actors. So we'd love you to take part. So if you want, there's the QR code. If for some reason it doesn't work, or you email me after, and I'd be happy to send you the link. It's 2 hours, and yeah, we'd love to hear your voice in the consultation as we build all of these responses from the consultations into the strategy. So thank you for that. So some of my colleagues developed, it was launched last year for World Mental Health Day, the WHO Mosaic Toolkit. And it's was developed in collaboration with people with lived experience, and it provides guidance for designing, implementing interventions to reduce stigma, discrimination across different sectors, including people with dementia, and sort of empowering individuals, community engagement approaches, where to best target trainings, etc. So that was fairly recent. This was launched April this year, so very recent, given the challenges at the moment that around the world. So this looks at migrants, older refugees who may have dementia or may be developing dementia, how best to support them. So apologies, I'm ill, so I'm just gonna drink water. One second. Sorry. So this is brand new, so yeah, could be relevant in your in your work to disseminate. I've got the QR code. This one I'm sure most of you will be familiar with. The guidelines developed at headquarters, evidence-based recommendations on lifestyle behaviors, interventions to delay or prevent cognitive decline and all types of dementias. It's available in different languages, including English and Spanish. This is the I Cope, which again, I'm sure many of you will be familiar with. The second edition was launched in December, so this is the newer one. So really, again, guidance, so evidence-based, how to assess so how to provide person-centered assessment and pathways in primary care to then go into sort of more secondary, tertiary care. This eye support for dementia is developed for carers primarily. So it has 5 different modules, really on how to take care of yourself as a carer. So self-care, mental, physical health, where to access support, when sort of a checklist on when do you think you might need respite care, etc., etc. So it really teaches carer how to address some of the common challenges, and again is available in different languages. So I won't show you this video, but it talks about eye support, and I screenshotted on this gentleman who's a carer in India, and he says we were not communicating much with society because of the social stigma, and I think that really sort of resonates with me, the link between social isolation and stigma, and how education at all levels is really key to reduce some of the fear that isn't either we instill in ourselves as carers, as people living with dementias, as people in society, and how can we build tools to reduce some of the stigma so that people don't feel that isolated or at risk of social isolation, which we know is bad for our health. So I will, sorry. This has been for a while. It's the Global Dementia Observatory, so it has a lot of indicators to measure progress, and it's our monitoring and accountability mechanism. So it has lots and lots of different data which you can adapt in different ways, which you may find useful. So I thought I'd add it here. Sorry. This is the global action plan on the public health responses to dementia, which I'm sure most of you will be familiar with. And actually, at the World Health Assembly now in June, I think that they are discussing how to renew it. So there are different work packages. So some are around universal health coverage, equity, how to empower people, families living with the condition. All the activities around human rights, etc., etc. And lastly, so there are different documents at WHO. This is one of them, so I only mentioned one. So Blueprint for Dementia Research, so looking at how to support dementia research, where do we foresee priorities, and how can we provide a coordination mechanism. So that's it from my side. Yeah, thank you for listening.
Thank you very much, Frederic. A really interesting presentation. And be sure that we will look at all your materials, and we know many of them, but not all of them. And we will look at them, and we will, with your authorization, we will promote them through our social networks, because it is important to leverage all the materials and elements that all those entities that are so specialized in this field can offer to all the citizens in general. So thank you very much, Frederic. I don't know if anyone wants to ask anything to Frederic. If so, you can turn on your mic or raise your hand. Otherwise, and that we are a bit late on time, we will go on with Kate Burellis, the Communication Officer of Alzheimer Europe. She will give a presentation giving a voice to people with dementia and carers, how Alzheimer Europe's communications help challenge perceptions and combat stigma. So, Kate, when you want.
Hello, so good morning, everybody. I'm hoping that I've successfully managed to share my slides.
Yes.
Hurrah! Okay, well, that's a good start. Okay, so first of all, just thanks very, very much for having me. It's really an honor and a pleasure to talk to you all today. And thank you very much to Jade Health for organising, and of course to all the speakers for the wonderful presentations. Okay, so today I'm going to talk to you all a little bit about how Alzheimer Europe's communications hopefully helps to change perceptions and combat stigma by giving a voice to people with dementia and carers. I put in a little slide just about myself, which I'm not going to run through with you, but I believe the slides will be shared anyway with participants. But just to say that, yes, I'm working as Communications Officer at Alzheimer Europe, and I joined the organisation in 2013, so it's been a while. I think that's over 12 years now. And I believe my colleague, my newest communications colleague, Margarita, is part of our delegates today. So hi, Margarita. And the full communications team not quite present today. We also have a communications assistant, but she is in China at the moment on holiday, so she couldn't join us. Okay, so just a brief overview of the contents of my presentation. So I'm going to give you a little introduction to Alzheimer Europe and to our working groups. I'll tell you what they are, give you a little overview of the communication tools that we use and how we use them to give a voice to people with dementia and carers. And I will also give a very brief introduction to our annual Anti-Stigma Award, and to our guidelines for the ethical and inclusive communication about people with dementia. So Alzheimer Europe has been around for quite some time. The organisation was founded in 1990. We have 41 national member associations from across the WHO European region, so 36 countries represented in our membership. And we are based in Luxembourg, which is where I'm speaking to you from my living room. And you can see a photo there of the Alzheimer Europe team, such as it was in October last year at our annual conference. Okay, so our strategic objectives, I'm not going to run through them all. I just highlighted a couple of them in bold because I wanted to stress how important these are to our organisations. Out of our 6 strategic objectives, 2 of them are to provide a voice to people with dementia and carers and to change perceptions and combat stigma. Okay, so these 2 groups of people are extremely important to our work. So these are our working groups. On the left, we have the European Working Group of People with Dementia. And the photo there was taken in October 2024. So it's the most recent group photo that we have. And the group itself has existed since 2012. And on the right, we have a more recently formed group, which is the European Dementia Carers Working Group, and which has existed since 2022. These groups are made up of members from across Europe. They are nominated by our national member associations. We try as much as possible to have a gender balance in the groups, and we encourage our member associations to nominate members who are male, female, non-binary, trans, and at the moment both our groups have male and female members, and we don't currently have any trans and non-binary members, but we are very much open to members of all genders joining the groups. So the groups themselves, they elect their own chair and their vice chairperson. So essentially Alzheimer Europe doesn't have control of who is in the group and of the group's chairs. So they are very, very much independent in how they operate and in the choices that they make. Okay, so as an organisation, Alzheimer Europe is very much committed to giving a voice to people with lived experience. So by that I mean people with a diagnosis of dementia and also those who are supporting them. And we try to ensure that we include those people in every aspect of what we do. The working groups that we have contribute to our policy works, our campaigns, they contribute to our communications, our annual conferences, the work that we do on research projects and our publications, among others. The chair of each group is on our board of directors, and so in these different ways we try to ensure that their voices are very much heard and that their needs, opinions and wishes are reflected in everything that we do. Okay, so now I'm just going to give a quick overview of our communications tools. Here I've listed pretty much all of the tools and channels that we use, but the 4 at the top of the list, so the website, newsletter, magazine and conference, are the ones I'm going to talk about today. So starting off with our website, that's just a few little snapshots of some of the homepage. So there's the address of the website, and the aim of it is to support our communication and dissemination activities. Using the website to give a voice to people with dementia and carers. So one of the things that we did when we launched this new look website in 2021 was that we specifically asked members of the European Working Group of People with Dementia to give us feedback on the look and feel of the website, and we incorporated a lot of their wishes and suggestions to try to make the website itself as accessible to them as possible, and to include their wishes and their suggestions. In terms of contributing to the website, members of both of our working groups, so carers and people with dementia, contribute to our news section, and we have a Living with Dementia section in there, and they also contribute to the research section of the website. And the European Working Group of People with Dementia was instrumental in helping to build what we call our Clinical Trials Watch service, which is an accessible, up-to-date database of information on clinical trials in Europe into drugs for Alzheimer's disease and or dementia. They also contribute to the policy section, to our campaigns, our yearbooks and our policy positions. Okay, so moving on to our newsletter, which is issued on a monthly basis. We have around 11,000 subscribers, and we also share this newsletter via our website and our social media channels. So within the newsletter, we have a section called Living with Dementia, and members of both of our working groups contribute to this section on a monthly basis. It's also open to other people with lived experience from national working groups, for example. So here I've just given a few sort of snapshots of some recent articles by people with lived experience. So, for example, on the left and on the right-hand side at the bottom are two articles from a carer called Annick Hermes from, I have no idea if I pronounced that correctly. I hope I did. She's from Belgium. And her husband Gert is living with dementia. And these are a couple of articles from her about the work that her and Gert are doing together on the left, and then on the right-hand side about his participation in a number of marathons, which is something that's really important to him. And she writes about how she supports him to do that. Then we also have an article from a carer in Norway. We have an article there from a lady, a woman called Gerda van Tongerlo from the Netherlands, who is living with dementia, and it's about her participation as a researcher in a project. On the top right, we have the chairperson of the Carers Working Group, Trevor Salomon, writing an article. And then kind of in the middle there, we have an article from the vice chair of the Working Group of People with Dementia, Lieselotte Klotz, and a photo of her with her, her late mother. Because she had this kind of dual role of being a person with dementia, also caring for her mother with dementia. So it's quite an interesting perspective that she has. Okay, so these articles and other articles about the work of the group and about the members of the group are highlighted on our social media channels. The main ones that we use are X, Facebook, and LinkedIn. These are only snapshots from X, just because that's what I had time to gather, but it's just to show you a little flavour of sharing the articles of our working groups on our social media. Okay, so moving on to our magazine, the Dementia in Europe magazine. It's published 3 times per year in February, June, and October. And it has a similar readership to our newsletter, but it also reaches all of the MEPs and many national policymakers, and it has much more of a policy focus. So these are just some of the recent covers for the Dementia in Europe magazine. So within the magazine, we invite members of our working groups and other people with lived experience to contribute articles, and you can see a few snapshots of recent articles there. And whenever we have an article written by a person with lived experience, we try to feature them also as one of the cover photos on the magazine to really try and kind of highlight their contributions. I won't go into the details of each of these articles because I'm aware of the time, but there's really some lovely contributions about all sorts of different aspects of life, you know, from kind of health issues to art to care for other people in the family with health conditions and all sorts of aspects of life from the people from the working group. So it's usually a really interesting read when we get an article from one of our working group members. Okay, so moving on to the annual conference of Alzheimer Europe. This is one of our kind of biggest annual opportunities to share our work, the work of our working groups, and to highlight the work of our member in the host country. So this year will be in Bologna in Italy. And during the conference, as well as before and after, we engage with delegates via X and LinkedIn to kind of get people to join the conversation using our hashtag. And here you can see just some of the posts from last year's conference in Geneva from various delegates and speakers at the conference. So in terms of giving a voice to people with dementia and carers via our conference, We have at the conference 5 plenary sessions, and the first of those is dedicated to, organised by and presented by members from our working group of people with dementia and our European Dementia Carers working group. So the photo on the left is from Helsinki in 2023, where the session was entirely organised and presented by the European Working Group of People with Dementia. You can see them there on stage. And on the right, these were the speakers from both groups in Geneva. And here are just a few snapshots from other sessions, both in Helsinki and Geneva, because members of both of the working groups, as well as others with lived experience, feature as speakers in many of the sessions throughout the event. Okay, so the contributions that are made by the working group and other people with lived experience are highlighted through our communications, so our press releases, social media, and our conference publication, among others. So on the left, you can see social media posts during the first plenary of our conference in Geneva and in Helsinki. And on the right, you can see the front cover of our conference publication, which we publish as a supplement to our magazine. And you can see that we highlight on the cover the first plenary session at both of those conferences. Okay, so just a few main messages. I'm not sure why my speaking notes seem to be appearing next to there. I hope you can't see them because they're not really relevant to the slide. But yeah, some of the main messages that I wanted to deliver is to not make assumptions about people, about who they are and what they want, but to ask them, to involve people with lived experience in all aspects of our work, to ask them for their feedback and contributions, and to really listen to them, not just to have them there as tokens, to give people with lived experience a voice, and to showcase them and their words. To help reduce stigma by involving and highlighting real people with lived experience, and highlighting their abilities, opinions, needs, wishes, and feelings, and to encourage others to do the same. Very, very briefly, I would like to introduce you to our Anti-Stigma Award. So for the last couple of years, together with our Alzheimer Europe Foundation, we've organised an annual Anti-Stigma Award. It recognises kind of outstanding work combating stigma around dementia, and these awards are available to individuals and organisations within a member country of Alzheimer Europe. Last year it was for journalists. The picture that you can see on the right are the 3 winners of that award at an event last December. So the winner is on the left. His name is Magnus Rengli from Switzerland. The woman in the middle is Ofelia Kamavosian from Armenia, and her radio show came in 2nd place. And on the right, we have Andreas Kaimeyer, who came in 3rd place for his late night talk show, Willkommen Alzheim. We're going to be launching the edition for 2025 next month, so watch this space, and you can find out more via the link that I've put at the bottom of the slide there. And very briefly also, we have a set of guidelines for ethical and inclusive communication about people with dementia, which may be of interest. These were launched in early 2023. And they're structured around 14 statements, which were developed, it says in tandem with, but they were actually developed by the European Working Group of People with Dementia, who are listed as the authors that you can see on the right. And they're aimed at members of the media, researchers, journalists, policymakers, and anyone, including all of ourselves, who are responsible for the portrayal of or communication about dementia in the public domain, and the link is there at the bottom of the slide. And I'd like to just thank you all very much for listening, and if you want to see our various social media channels, etc., and follow us, you can visit our link tree, which is there on the slide.
We will do so, of course, Kate. Thank you very much for your very interesting presentation. Also, as WHO, Frederic, lots of very interesting materials we will look at. And I love the focus Alzheimer Europe puts on carers, not only on the people living with dementia, but also on the carers, as Frederic did, and trying to know about their needs and wishes and involving in the communication about dementia, and also the importance of involving in the design of new public health policies related to dementia. Thank you very much. Very interesting. I don't know if anyone wants to ask something to Kate. I repeat again that we are late on time, so if anyone wants to ask anything. Anyway, you have our emails. If you want to ask anything to the speakers later after the workshop, please send us an email that they will be willing to answer all the questions. So now, Vera Nice, project leader of the European project Radar AD, will explain the Radar AD communication and dissemination strategy communication made with sensitivity and integrity. Vera, go ahead when you want.
Thanks so much. I hope you can see my slides. Is it working?
Yeah, it
Great.
works perfectly.
I also have a little video included, so I hope the sound is working. Ines, thanks for the pointers on which button to push.
You're welcome.
So first of all, thanks so much everyone for this opportunity, and really nice that we can talk about this important topic. The title of my talk is Communicating with Sensitivity and Integrity, the Radar AD Communication Dissemination Strategy. I'm here today representing the Radar AD Consortium, which is a large public-private partnership. I have some more information on Radar AD a bit later on in this slide, but I actually work for Foundation Ligature. We're an expertise center for multi-stakeholder partnerships with the sole goal of accelerating the development of new therapeutical solutions for patients by driving public-private collaborations between all various stakeholders. First, it was mainly academia and industry, but now increasingly, luckily, patient organizations, regulators, and society are also included. We provide all types of expertise for partnerships. We're with 55 people, 10 nationalities, and we're based in Utrecht in the Netherlands. And in that capacity, I've been involved in Radar AD. It's an IHI or IMI funded project with a budget of around 7.5 million euros. With 60 project partners. The project already stopped about 2 years ago. And as you see, some of the language in the slides is also maybe a bit outdated already, because the language around people with Alzheimer's disease and dementia is changing over time to become more inclusive and empowering. So sometimes you see me refer to patients and carers, but I think it's exchangeable with people living with Alzheimer's disease or people living with dementia, depending on the context. So the main goal of Radar AD was to develop and validate technology-enabled quantitative and sensitive measures of functional decline in people living with Alzheimer's disease, with the hope that it would lead to better remote assessment of disease, better clinical trials, and very important, also better caregiver support. If you would like to know more about the project, you can also take a look at the website. And it's also nice to mention that part of the work that was being done under Radar AD is continuing under IHI's Predicton project, also looking into Alzheimer's disease to help optimize treatment and care for people living with this condition. Then next, I can tell a lot of stories, but I thought I'd show you an example of how we did communications in Radar AD. And I think patients and carers and patient organizations are, I think, in the best position to tell how they feel they should be engaged with in these types of projects and how they feel communication dissemination should be done. So what I'm going to show you is a movie that we made towards the end of Radar AD, where you will see people from Alzheimer Europe also in this call, and members of their working groups sharing about their participation. And later on, I have a list of important, they're very concrete points and considerations that you can take along if you are working on communication dissemination, these types of projects. So let's see if the video will be loading. Oh yeah, it's always a bit slow, apparently. Yeah, there we go.
Hello, I'm Diane Gove, the Director for Projects at Alzheimer Europe, which is a European umbrella organisation with 41 member associations in 37 countries. Together with my colleague, Ana Diaz, I support the Patient Advisory Board of the RADAR AD project. This advisory board has been carrying out public involvement activities since the very start of the project in 2019. Public involvement is about members of the public, in this case people with dementia, people with mild cognitive impairment and their supporters, providing their perspectives and insight into living with these conditions. And some of the members, Helen, Chris, Larry, Gianni and Ikuko, are going to tell you about their work and why it's important.
Well, for me, being part of the Patients Advisory Board has been an empowering experience. As a member, I was able to see firsthand the benefits of us all being involved together. With researchers, we met on a regular basis, with lots of interaction about the devices that were to be used by the participants in this study, such as watches and cameras and sensors. And our feedback was highly valued, and we were able to influence change, which was really important in this research process, and this was appreciated by everybody. Despite the seriousness of the topic, we were able to find joy and laughter in the discussions with the RADAR team. For example, people like myself, when I went to the supermarket in Northern Ireland where I live, I wondered how the neighbours would feel about me walking around with the camera on me. And also for my colleagues, they had different thoughts. So these moments of levity helped us, of course, to build a sense of camaraderie and support. And then the pandemic struck. Everything changed. COVID-19 stopped the work of the advisory board in its tracks. But you know what? We're a resilient team. We quickly adapted to our new world of Zoom, and we soon resumed our work, albeit from a distance and in isolation. It is a welcome relief to be able to see our friends again and to continue our work together. Through all of this, we have continued to contribute to the process, and I feel proud to be part of this important work.
One of the things I enjoyed most was being involved early in the process, making it understandable and supportive for participants, developing accessible documentation, which all help not just the researchers, but also the retention of those taking part. Looking at and selecting the different devices was very interesting, how to adjust them for the best use, how to set them up for best efficiency, and make them work for those using them. We as a group realised that not just retention of participants can be an issue, but also attracting people to take part. We made a recruitment video explaining the project, how easy it is to take part, and most importantly, how they, the participants, can change the future for the better for all.
RADAR AD is a very exciting project because of the potential of using remote monitoring technology. We used digital wearables and everyday devices to help advance research, diagnosis, and to improve the lives of people with mild cognitive impairment and dementia. What I think makes this project unique is that existing devices, which many people already are familiar with, were used to collect information. And this offered the possibility of predicting whether or not changes in daily life indicate dementia being present or whether it is progressing. This project showed how monitoring a dementia condition could be moved out of the memory clinic and back into people's daily lives. Remote monitoring of activities in daily living might eventually contribute to effective routine diagnosis and management. Of course, people may even experience challenges using familiar technology, especially some older people, people with mild cognitive decline. Some of the challenges that members of the Patient Advisory Board discussed were also linked to barriers to access for some marginalized groups and a lack of good digital infrastructure or in rural areas, and for some people, a fear or a lack of familiarity with technology. Lay members of the Patient Advisory Board made many suggestions to the research team about finding workable ways of using devices ethically and reliably.
Just because you get a diagnosis of some type of dementia does not mean that you're over the age of 65 and live with a wife or a husband in the same house. Some of us carers lives in another city and is a daughter like me, for example. And that is why it was good to have carers involved in the public advisory board to consider and to listen to the perspectives that we have and what we feel is important and not in a research like this, to be able to help out as much as we can.
In most cases, a person with dementia has to have a research partner to participate in research. Some must be reminded when to do something, and others need to be reminded what to do. So it is important for researchers to understand the needs of the research partners and how to support them. For example, if an app is used, that the research partner could have the same app so they can do this together. The needs can be very varying a person to a person, so it is very important to have good communication with the participant and his or her supporter about the person's needs.
I would like to congratulate everyone involved in this great project. All of the work would not have been possible without the openness, respect and enthusiasm of all those involved in Radar AD. A big thank you to all the work that you do and have done, plus for not just bringing us to the table, but also for listening to us. Which brings me to my favourite phrase, nothing about us without all of us.
Yes, so that was the movie that I wanted to show you. And every time that I see it, I'm so proud of this group. And I really care for these people. So it's really great to be able to share this with a wider group. And then back to everything in tables. What you see here is the essentials that we applied when it comes to communicating with integrity about Alzheimer's disease and dementia. The first one is, I think, the most important one. Where possible, try to co-create with people with lived experience and engage patient organizations or patient advocacy groups as early as possible in the progress, because these are the people, they know the condition best. They know what patients and their carers need. They know certain sensitivities. They have a great network that you can also use for dissemination. So yeah, you don't have to reinvent the wheel all the time. There's a lot of knowledge available. So really put these in, pull these in, engage them in your project. Yeah, I think it's the most important one, the most important principle to apply. Yeah, why it matters. It helps to validate and improve the messaging and ensures real-life relevance and relatability. There's also ethical and moral imperatives, which are often overlooked. Yeah, I think there's really an ethical part on this that is increasingly being recognized. That it's not very ethical to talk over the heads of people that concern your research topic. You really have to talk with them and engage with them. As Chris was saying, like, yeah, it was not just talking to us, but it was also listening to us. And that's something that is really appreciated. Then the next principle is to pay attention to clarity and simplicity. Both people living with this condition and carers may have cognitive challenges or certain emotional stress. So you have to make sure that info is digestible. At the same time, you really should not paternalize people with lived experience or underestimate them. They're perfectly capable of telling what they want to know and what they rather not know or not like to know when something is too much for them. And also carers are really nice to talk to when it comes to this, and you know, look for the right language to in a clear and simple way express where you would like this to go. The next one is transparency and trust. You have to be transparent about the research that you're doing. And in our case, it, for example, related to data use, to how technology is applied, potential risks. And it's important because people need to be able to make informed decisions. So you shouldn't oversell things. You also don't have to be overly negative, but just be transparent and be mindful of the trust that is put into you and that you have to build up during such a project. Then sensitivity to language, avoid reinforcing stereotypes or stigma. we deliberately framed our messages around capability and dignity. And people also told us, yeah, we're very interested in getting more insight in what we still can do, and not in hearing what we're losing over time, but what can I still do? What tools can be developed to evaluate what I can still do? So we also phrased our messaging around that. And you can check language and images with people with lived experience for their preferences. And then we also use diverse channels and formats, from lay summaries to policy briefs and different interactive tools. You have to be mindful again of language here, and potential technological barriers. And so as we're a European funded project, English is the, let's say, the main language that we use, but we also had people participating from different countries. So there's a bit of a language barrier every now and then. So that's also something that you have to be mindful of in these European projects. We deliberately picked a positive tone, but also we didn't want to give false hope to people. So messages can be empowering and positive of tone. But as I mentioned, it should never overpromise or create false hope. And it also relates to being transparent and trustworthy. Then it has to be rooted in science. So facts or certain statements should be based on scientific results and be backed up by data. Also, again, it's ethical, and it helps to increase transparency. At the same time, you have to make space for personal stories and subjective experiences, because people's personal experiences and stories matter. I think in view of time, I'm going to stop here. And there are a few slides more where I talk about how we tailored our strategy and implemented these things. But I think this is the take-home message that I wanted to share with you, which leaves me to say thank you all for listening, to thank everyone from the consortium. I can really recommend to take a look at our project website. And if you have any questions or would like to collaborate on this topic, please send me an email and I'm happy to tell you more. Yeah, I'm going to stop here. Are there any questions so far?
Thank you very much, Vera. Very interesting presentation, and thank you for these latest messages that are great. Yeah, my feeling is that we are learning so much today, well, thanks to all the speakers, because there are important messages and innovative materials and initiatives and all the videos. It is great. Thank you very much. There is a comment in the chat. Let me see. Kate, I wanted to mention that an interview with Tom about his and Jonathan's excellent documentary film, Human Forever, will be featured in our Dementia in Europe magazine, published next month. You will be able to find it here. Thank you. Thank you very much, Kate. Now we will move forward. Stravula Siku, project manager of the European Project for Elders, will tell us about the strategies they follow for communication dissemination and stakeholder involvement in dementia-related initiatives. Stravula, when you want. Thank you.
Yes, thank you, Ines, for the introduction. Good morning to everyone. My name is Stravula Siku and I'm working as a European manager in ACME. I'm going to share my presentation, Ines. So,
okay, you can.
Okay, great. Can you see my screen?
Yeah.
Okay, great. As Ines said, today.
Sorry, Stravula. Yes. We are not seeing in full mode, just in case you want to change it.
What? You cannot see?
In full, in complete screen, full mode.
Why? Wait, I'm going to share again. Sorry.
Now
it's
perfect.
Okay?
Yeah, thank you.
Okay, great. Thank you. Okay. So what is, I would like to start with setting what is a stakeholder engagement. Stakeholder engagement refers to the process of identifying, involving and collaborating with all individuals, groups or organizations who have an interest in, are affected by or can influence a project or its outcomes. What these stakeholders can include? They can include non-governmental organizations, community organizations and advocacy groups, people living with dementia and their families, technology providers or innovation hubs, caregivers and healthcare professionals, policymakers and public authorities, as well as researchers and educators. Why it matters to engage stakeholder? Because it ensures relevance and responsiveness of the project goals. It builds trust, legitimacy and transparency. It encourages co-creation and shared ownership, and it enhances uptake, dissemination and sustainability of results. So what does stakeholder engagement require to be successful? It requires a clear purpose and scope, and with this we mean that stakeholders must understand why they are being engaged, what decisions or outcomes they can influence, and what the boundaries of the engagement are. Second, early and continuous involvement, which means that the engagement should begin at the earliest stages of the project planning and continue throughout the life cycle of the project. This means that a late engagement equals to a reduced impact. Also, another important aspect is the inclusivity and the diversity. More specifically, people living with dementia. It's about people that live with dementia, family caregivers, health professionals, and policymakers. We should take into account also ethical considerations. That means that we need to obtain informed consent before any action, ensure data privacy, and avoid overburdening the vulnerable groups like people with dementia. Another important aspect is the capacity building, which offers support, training on resources in order to enable a meaningful participation. And what we try to achieve with this engagement is to build a long-term and sustainable relationship. One of the most significant aspects that we have considered is that in an era that digital transformation prevails, it's really important to focus on the physical presence and face-to-face interaction. As I said, digital reach is important, but meaningful engagement often requires being physically present, especially when it comes to vulnerable groups like people living with dementia. This is important because it helps in order to build emotional trust more effectively than the digital-only methods. It allows for real-time co-creation and richer discussions. It encourages deep listening and mutual empathy, and it enables non-verbal communication, which is critical in dementia contexts. We end up in a very good balance between the face-to-face and the online communication. Let's talk now about the stakeholder engagement in the Care for Elders project. In ACME, we coordinate this project, which has been designed in order to support and upskill the elderly care workforce in order to be able to offer a targeted and high-quality care to people with dementia. One of our actions includes a reach-out strategy to educational organizations, such as universities and higher education institutions involved in the project are stakeholders, who they can also contribute to the development of training curricula and resources. informal and formal caregivers organizations are organizations representing both informal caregivers, like the family members, the most common category, and formal caregivers that have a vested interest in improving elderly care practices. Market representatives, entities involved in the market for elderly care services and products, which are stakeholders who will benefit from the project's innovative practices, policy and umbrella organizations. There are various policy and umbrella organizations across the European Union that are involved in the project and represent the interests of the elderly care and healthcare policies. So how? We are in the process of the development of an engagement plan. So we have a number of target groups, that is the elderly caregivers and healthcare professionals. And how we are going to engage them with a direct way through business forums and networking events, collaboration on pilot projects and case studies, and industry exposed to showcase innovations. Also, for the next target group, about the education organizations and the caregiver associations. There are plans for a regular policy update newsletters to keep stakeholders informed, as well as the organization of policy roundtables to discuss and shape future market strategies. Concerning the third target group, the policy decision makers, we plan to include to form an inclusion in advisory boards to influence curriculum standards, to engage them through academic conferences, and to participate in joint research projects. And the last target group, it's about the market representatives in the elderly care. Here we have in our mind to send direct emails to individuals and institutions, to organize local community workshops, and to liaise with healthcare institutions for integration and feedback. As I said, this project focuses on the upskill of the elderly care workforce. For that reason, we are going to develop an innovative curriculum. So we plan to engage stakeholders from the elderly care sector in order to validate and refine the curriculum. Also, concerning the identification of relevant local stakeholders, from the very beginning of the project, we formed an Excel sheet where we use it as a comprehensive database, and we focus to gather 800 plus stakeholders that we are going to use as an outreach mechanism. Also, with the end of the project, we plan to organize a final conference where there will be a panel of keynote speakers, organization of World Cafe, and ice-breaking activities. And through these activities, we're going to engage the most relevant stakeholders. And last, we also focus on the identification of relevant local stakeholders through interviews and focus groups that are currently running. We're conducting interviews and focus groups with stakeholders from this field. And to conclude, in order to sustain the stakeholder engagement, a strong dissemination strategy must include and follow-up actions to keep stakeholders engaged through channels like social media, newsletters, and project updates. The engagement should go beyond stakeholder profiles. Each individual needs a clear incentive to stay involved, like professional development, recognition. Also, the transnational dimension of dissemination is especially valuable for researchers. with cross-border collaboration and visibility, for policymakers with an access to comparative data and best practices, and for market actors providing insights into the unmet so far needs and innovation gaps. Also, social media helps amplify deliverables and reach, but as I said before, face-to-face interactions are essential for a better common understanding, for deeper discussions, for the building of synergies, and for the clarification of the role of each partner. And now I would like the active participation from you. If you could scan here the QR code, and if you could answer to the questions, if you had to choose only one dissemination method to engage stakeholders in the long term, what would you prioritize? I hope it works, but we are gonna see if I receive any answer from you. Okay, let's wait a bit more for the rest to scan and join. Okay. Interesting. Until now, we have the interactive training sessions coming first. Okay, if we consider this, we have a little deviation. Right? Okay, I'm waiting a little more for everyone to answer. Okay, as we can see here, the interactive training sessions come first, then we have the social media campaigns, then the face-to-face events, and last the policy roundtables. I think there is one more questions. Okay, again, I would like your attention. I would like from you to rank these the following strategies from most to least effective for dissemination in dementia-related projects. Okay. There are people that still ranking. Okay, so yeah, we can see until now that the co-creations workshop come first. Then we have the in-person events along with the social media and digital content. And as I can see, the stakeholder databases are in the 4th place. And I consider it's not an easy also way to, an effective way. We face difficulties in order to gather data from my experience to this project. Okay, thank you for your participation and thank you for your attention. Here are our social media for our project and the website. So, Ines,
Thank you very much, Stavroula. Very interesting presentation, and thank you very much for focusing on the involvement of stakeholders, which are a key element also in Gate Health, and very useful recommendations, and thanks for sharing your strategy. Thanks a lot.
You're welcome. Thank you.
And now, very quickly, Luke, our apologies because we are a bit late, but Luke Nicolas, he's an Innovation and Exploitation Manager of the European project Comfort Age. He will give us some hints on the dissemination strategy of the project Comfort Age. Luke, go ahead. Thank you.
Thank you very much, Ines, and thank you for staying a bit longer to listen to me. Do you see my slides? Yes, you see my slides? Yes, okay, wonderful.
They are not in full mode.
They will be. Okay, they are now in full mode. Thank you.
Perfect.
So basically, well, my presentation is basically trying to see how basically the perspective can be a bit different when we bring innovation and technology into this debate. As we are now evolving and we are experiencing a very big change in healthcare system, where basically decisions are more and more made based on data and on evidence. And data is basically becoming really the source of political decision today for many reasons. And what we try to achieve in this project is basically to bring different worlds together. So to have a way to bring not only the technology, but also a number of actors who are not necessarily always speaking together. So basically, this framework is about trying to enhance the community around an integrated and people-centric approach, focusing on prevention, but also monitoring the progression of the disease and helping people to manage conditions for dementia and frailty. But as I said, actually, we try to connect different worlds which have differences. For example, many projects are working either with researchers or clinicians, and of course, with the involvement in both cases of the patients and the carers, but often it's really not. And that's why I'm so happy to be part of this initiative today, because that's a very important initiative to bring innovation and implementation together. But it's also a way for us to bring social and clinical care, which are also separate. And we speak about communication. They are still isolated worlds, which are not yet connected sufficiently today. That's also how to combine studies and knowledge creation with personalized care. So it's really something which is still missing. And what we try to do is basically in our work to focus on three key things. Innovation is quick and evolving very quickly. So there are new things coming up every single day. But in this project, we really want to consolidate as much as possible what can already be exploited so that it can be reused and improved and further integrated. So we need to have an impact, and we have the possibility with technology today to have a more direct impact on a number of things. And of course, I fully agree with Stern that it's a new mix that we need to reach between quality of care and quality of life. And in this project, we don't forget at all about quality of life, and we really see how technology can support specifically this objective. Also, how trying to work on the 12 modifiable risk factors. And as you see, well, the 40-60 percentage, I won't go into all those statements. You probably all know them very well. But the idea is indeed to work on every single person conditions, not only from a clinical perspective, as dementia is also, we know it, more and more a problem which is not only occurring after 60. There is a possibility to identify already a number of things, and more with new biomarkers much earlier in a lifetime. Thus, we really try to develop a personalized approach, which takes clinical but social, personal environment into consideration when designing an intervention pathway. So as you can see with this slide, which tries to bring a number of keywords on which we need to work, the focus is indeed data, but for data to be useful, we need the participation of course, everybody, and in particular also of the patients and their carers. We need also to have something as open as possible. And so that's another very important message for communication. There are too many initiatives which are still locked in. And even with very important resources, be it for technology or even for policy making, which disappear with projects. So they need to be open and reused. And that's also true for data, of course. Data needs to feed further knowledge, it needs to be to be used after the project ends. We have now with the European Health Data Space a possibility to connect projects to stable infrastructure. We can't deal with projects the way we used to do it. We need to use standards. We need to promote standards in order to create more synergies between projects and more and with those infrastructures. We are also at the edge of a revolution. And here, that's just a slide which shows how we are slowly moving toward the so-called meta health. That's exactly what I said, where basically we are evolving towards a context of what is now called phygital, physical and digital, which is fully and partially immersive intervention pattern for clinical, with using human and non-human actors in near real settings. It can be a bit scary for some people, but it has proved also not alone, but it has a solution which can really make things change and contribute to a change of culture, because it takes into consideration needs which were seen as nice maybe to have, but not priority before. And for example, if you look at the data, one of the things we were doing this project is to work on with a digital twin of patients or citizens, which is just a way to integrate a lot of different data, being from collected from healthcare professionals, from the patient, from biomarkers, from neurological assessment, and bring an integration of those data, which helps to identify what can be done. And as you will see, that can help to define what can be done at the different stage of evolution of the disease. So there are a lot of technology there. I won't go into all of them, but you can have a look at it. What we want to try to do is basically to work on three key products for here. The first one is a platform which will develop thanks to this digital twin that I just mentioned, with the integration of data coming from 13 different pilots, a platform which will help to predict the evolution of the disease or the exposure of patient to risk. So with the definition of algorithms, but also a way to integrate data. It's also a platform which will integrate data coming from opt-in tools. So for example, serious games or personal health records from patients and families and carers, so that all those data can speak together. So we also have a second product, which is more focusing in training and education, where the idea here is to have resources adapted to each person profile. And again, that's connected with this platform, which will help to do that with some support of artificial intelligence. And finally, a validated marketplace. There are, for the time being, it's really difficult to know what is really already validated and useful. And so that's the ambition of that specific component. And as you can see, we have 5 categories of stakeholders that we have prioritized. And on the right side, you see the way we want to do it. So we first want to build the value proposition with those stakeholders together. And we have a number of channels to do that. And we will validate everything with everybody. The principle of making all the resources as fit to every single individual purpose is really at the core of the project. We need to rely on what is existing and not duplicate. So we want to integrate as much as possible with what is already useful. That's a competitive analysis. And finally, we look at every single component. So not only exploiting each of those bigger components, but each individual one, like the AI algorithm per se, can be exploited. That's, for example, the kind of initiative with whom we believe we all need to connect, where there are already a lot of data being collected and where there are a possibility to disseminate together a number of important results. We have tried to consolidate, and I've put in the chat the link to a report we have created, so that we build on the results of previous projects. And that's the 5 lessons we try to implement in the project and to use in our dissemination strategy. So this whole project is basically a co-creation project, both on technological side, but also on the content side, focusing on usability, simplicity, so with inclusive design strategies, very well-designed user interface, dealing with emotional attachment, and finally, really making sure that we put trust and social acceptance at the core of our messages. The 3 angles for our dissemination strategy, dementia and frailty, where we deal not only with 3 levels of prevention, there is a 4th one we deal with, which is basically identifying the gaps in the system and providing a quicker reaction, political reaction and implementation decision of what is identified. In order to do that, we need to start collecting data to identify those gaps. So dementia is certainly one of the fields. Another one is, for example, long COVID, where this 4th level of prevention is becoming increasingly important. And for that, we need to get out of the silos and reach out to different kinds of actors. In Comfortage, we really try to empower the community and new locations, not only clinics, not only resting homes, but basically where people go, where they can exchange, they can accept to be, they can discuss the need to be detected. And then we work also on data AI, and that's another cluster we need to communicate about. We need to find a way to make people understand how data are important and what we can do with them. And we need also to explain why projects need to use better standards, why the algorithm we develop needs to be also explainable so that the people are not afraid to use them. And we need, of course, to be completely aligned with ethics together. And finally, when looking at digital health, with our key messages on how best to profile and design hybrid care, so mixing human and digital interventions, and how to establish a collaborative ecosystem where digital solutions are not seen only as competitors, but also as collaborators. And that's the stakeholders we have. That's the one that you see in green, the most important one for the project. And as you can see, we went quite far in defining subcategories because they were important for us. So we are addressing all of them, but that's the 5 that we have in mind, that we really had in mind to work with. And we have designed now the value proposition of what we want to bring with them. And we have been using a lot of different inputs to do that. So we based ourselves, of course, on literature, but we organized surveys. We organized webinars and co-creation workshops with the different stakeholders. We have, of course, tried also to use inputs from other projects. And we have been conducting a number of different interviews in order to do that, in order just to make sure we try to capture really the most important messages. So what are the key channels for us to try to reach out to the communities and targets that we have in mind? We have defined three tracks for a channel that we call the Community Forum, which is focusing on services, on education, and specifically on AI, which is not a one-shot. It's a 3 to 5 series of webinars where we try to engage a real community in discussing and mixing the 5 categories of stakeholders every time. We have also identified 13 other projects which are working on multi-data integration, for which we can also share common practices, and so that we build on each other's strengths. We also try to, as we do it today, connect with other dementia clusters which are more policy-oriented, because that's what we miss really in this project. So we really need to do that. But we nevertheless try to do more and more now joint local events where we associate one region, one country with one important local event of Comfortage, so that we discuss our resources and we make sure then we can have a follow-up on that. And finally, of course, that's also a project involving researchers, so our publications are also very important for us. And as you can see on the right side, so that's there are a number of channels here that we try to use. So as a matter of conclusion, our strategy as an innovation, but also implementation project, is really to involve all partners and develop both local and global strategy. We don't believe that just having high-level messages is successful if it's not supported by people who are already known and which are recognized as important players in their own local system. So we need to work both at local and global level and reinforce each other. We need also to create a storytelling aligned with the project life cycle. And that's one of the key challenges for projects, is that basically they don't have much to offer at the beginning. And when they finally have some results, they have a very short time to disseminate what they have. So they need to be a strategy to address that and plan activities accordingly. The need of concrete visuals is also very important. Nobody knows what a digital twin is in many environments, so you need to try to make it concrete for everybody, you and me, a patient, a carer, without any specific education background needed for that to be understood. And we need to just to adapt this communication to each stakeholder also. So it's not only making it simple for everybody, but it's also trying to extract the key messages and transform them for the key stakeholders. And finally, my last message is really to try to position the project as being as open as possible. So that means that the communication strategy, if you only focus on your project, you're dead. You need to show how your project is, first of all, communicating with the global ecosystem, with other projects, with other initiatives, with associations like Alzheimer Europe, of course, and others in Europe. So, and that's, for example, in our specific context, our project here, we're thinking about other science-oriented data sharing platform. We're speaking about third-party end users applications and vertical platforms and in consideration priority technologies, just to focus on something specific. And what you see just at the bottom of the screen is a screenshot of the digital twin, the training and education toolkit, and the marketplace where we were trying to list all the solutions which are already on the market, which have been used, with a number of criteria which we are really meaningful for the users. So that's an attempt to really bring important solutions to the users with the criteria they really need to make their selection. And I want to thank you very much for your attention and having stayed with me till the end of this presentation. You can find more information on our website. Thank you very much.
Thank you very much, Luke. Thank you very much for your presentation, showing your activities and also your conclusions that I like a lot, that of adapting the communication to each specific stakeholder in order if you want to succeed in the communication process. So thank you very much, Luke. Now, I don't know if anyone wants to ask any question to Luke. Otherwise, I will give the word to Elizabeth, coordinator of the Joint Action Jade Health, to say some last words, because we are very late on time for the workshop. So, Elizabeth, go ahead.
Yes, Ines, just to say on behalf of the organizing team and of the coordination team of Jade Health, I want to warmly thank you all for your participation today. It has been a real pleasure to hear such insightful contribution and to see the level of engagement from everyone attending. The ideas and strategies shared today clearly show the value of collaboration and the essential role of effective communication in reaching the people who matters, those living with dementia, their families, and also professionals who support them. We hope to stay connected with all of you. In the coming days, we'll be sharing the webinar recording and presentation, and we also encourage you to follow our channels to stay informed about future activities and opportunities to collaborate. Once again, thank you for being here. may this event be just the beginning of many more conversation and joint events. Thank you.
Thank you. Thank you to all of you. Bye.
Bye.
Thank you. Have a nice day.
Bye-bye.
Have a nice day.
Bye-bye.
Have a nice day, everyone. Thank you.
Bye-bye.